Hi there, welcome. I'm Craig Smith. I'm doing my assignment on Anesthesia Carts in the operating room here at St. John Regional Hospital. The carts that we use are all standardized in this hospital. They can come in a wide variety of shapes and sizes, and they're probably different everywhere, but this is the one that we use here. As you can see, there's lots of things on the top, there's lots of drawers to store stuff, there's things on the side. We also have a monitoring cart over here that we use for various central lines, arterial lines, epidurals and spinals, and then we also have some supplies on top of the anesthetic gas machine and also in the drawers of the workstation. So without further ado, let's get into it. Okay, here we have the top section of the anesthetic cart. What we see is we can start from left to right. First and foremost, we have gloves to put on for personal protective use. We have different various kinds of tape that we use on an everyday basis usually. We have IV connector locks to place on the end of an IV, or maybe a second IV that we put in the patient. We have sterile water for injections, sodium chloride for injection, various number of needles readily accessible here on the top as we put these pull-out drawers. We have a nice stainless steel medication label holder. So we have all of our labels organized in fashion from left to right here. Also we have some tegaderms, just some stuff here that you probably use with every single case when inserting an IV. You'll have tegaderms, gauze, and some alcohol swabs here. Okay. Now, for the sides of the carts, we have a stethoscope to auscultate to listen if you're concerned about right main stem intubation or for double lumen tube placement, or in any case that you're just unsure about, you can have a quick listen to the patient's chest. Also, we have our sharps container down here at the bottom. It's fairly big, so it lasts quite a while. Usually gets changed on a weekly basis. Making our way to the other side of the cart, we have tourniquets here for starting an IV. We have a nice little label here that says all the anesthesiologist's names and what size sterile gloves they wear. We also have some scissors, quick access here on the side, bougies as a backup for possible maybe like grade 2, 3, or even 4 level of intubation. We also have some longer stylets down in this cubby hole as well. We have some pull-out drawers to make extra space for writing for the anesthetic chart. And our garbage bin here on the side as well. Now, starting with drawer number 1 here. This is a locked drawer for controlled substances such as narcotics. The anesthesiologist puts his narcotic box in here, and he can lock it up and uses a password and his ID badge to scan it. As you can see, mine doesn't work, to get into this drawer. Drawer number 2 here is our drug drawer. In this drawer is all the drugs you'll need to perform your basic anesthetic. You'll have regional or local anesthetic drugs here. And then in alphabetical order, starting at atropine, you have drugs going all the way from the left clear over to the right here, ending in norepinephrine. With the exception of your neuromuscular blocking agents such as rocuronium and succinylcholine here, and then your propofol also at the bottom right hand side here, just readily available there. Next is drawer 3 here. Drawer 3, as you can see, is all the different gauge IVs for starting an intravenous. You have 14 gauge all the way down to 24 gauge IV. We have winged and wingless. We have small syringes for local freezing before placing an IV. We have plastic blunt cannulas that can be disposed of in the garbage, instead of the sharps container. We also have filter needles for drawing up narcotics or anything that's in a glass vial. We have the odd iPads in here, maybe for your prone cases or where you want to protect the eyes. And we have some extra dead end caps here for placing on the end of an IV or an arterial line. We have Drawer 4, we'll open that, is pretty much all of the syringes you're going to need. You have 30 cc lure lock syringes. All the syringes in this drawer are lure lock. That's to make it a needleless system when you go to connect it to the IV infusion line to give to the patient. We have 20 cc syringes, 10 cc, 5, 3, and 1 cc syringes here. Drawer 5, you can see these two bottom drawers are quite bigger. They can hold some larger items. You have your 60 cc Lurlock syringes, possibly for giving them an infusion or Tiva anesthetic, propofol, or maybe giving some remifentanil or any kind of infusion that you'd like to give. We have infusion tubing right below it. As you can see, we have everything labeled in our carts, and also in the other drawers, I didn't show you, but underneath all the syringes we have it labeled as well, in case when it gets empty you know what goes there. We have some IV extension tubing. We have Solu-Prep for those extra times when you need it, maybe placing a central line or an arterial line. We have Dupeco Zorro eye masks, again for eye protection. You want to get those surgeons' elbows out of their face. For our end-flow fluid warmers, we have extra cassettes in here. For the heating pad, we have IV flushes, sterile. We have usually more than this, but we have some Sensicare glove sizes and additional LMAs for Plan B. If you fail to intubate somebody, we have nasopharyngeal airways ranging in various sizes as well. The last drawer on this cart is the drawer where we keep all of our IV solutions or crystalloids. We have lactated ringers, which we use the most frequently, pretty much for every case here. We have quite a few bags of those. We have small bags of normal saline, 50 milliliter bags and 100 milliliter bags. These are usually for drawing up drugs and injecting it into the bag to make it the proper concentration before you deliver it to the patient. We have our Volulite fluid expander as well. That's available to give to the patient, and we have 500 and 1,000 bag of normal saline as well. And over here we have our straight set IV tubing. Now, as I mentioned at the start, we have some of our supplies on our anesthetic gas machine that other facilities might have actually on their anesthetic cart. Like I said, every place is different, but here we have our extra Hall filters, or HMEs. We have some eye gels for backup emergencies, so you don't have to run out to get some for the central core. We have suctioning, temperature probes, extra suction lines, Yonkers, this monitors, ECG, extra leads on the side here. And I'll have to grab my phone to show you these drawers. We have extra supplies down in here, backup laryngoscopes, corrugated extensions for prone cases if you want to just give yourself a little bit more extension on the circuit, sprays, topical sprays, and topical jelly, and McGill forceps. Second drawer, we have extra masks for various sized patients, also OPAs in various sizes. And the last drawer is where we keep our extra tubes. Also, there's usually a couple armored tubes in here. We have 4s all the way up to 9s. Obviously, a lot of 8s and 7s, as those are our most popular. And we have our extra desflurane and sevoflurane that we use for giving inhaled volatile agents. At this institute, the hospital, we also have monitoring carts, just an extra little cart that we can trolley around from room to room if we need it. It usually consists of a top, of a base where we put everything that we're going to be using, and a sharps container on the side here. Looking at the drawers quickly here, we have our top drawer. Top drawer has Arrow arterial line insertion kits, smaller size and a regular size, 22 gauge and 20 gauge. And we have our 22 gauge arterial line kit here as well, in a different in a different form. In case the arrow doesn't work, we have a different one. We have various cleaning solutions here, 14 gauge IVs. Some people like to pre-poke the skin with a 18 or 20 gauge needle before they insert the art line. Drawer 2 in this is what you're going to find for your epidurals and spinals. Pretty much that's all it's it. Has some extra insertion IVs there, a 2E, a 17 gauge 2E, and various Quincke and Whitaker needles there for that. Also on the bottom here, there's a little cubby where we have an additional epidural anesthesia kit. And the very last drawer is where we find our stuff, our supplies to make central lines. We have 6-way manifolds, we have a double lumen central line catheter, we have a single lumen central line catheters, and we have our Aero percutaneous sheath introducer kits, which are our regular central lines. On the bottom here we have our multi-lumen central venous catheterization kit. So everything in here you're going to find to put in a central line. So overall, I may just be saying this because I'm familiar with this hospital's anesthetic carts, but I like them. They're fairly new in this hospital. Beforehand, about 4 years ago, every anesthetist had their own cart and laid out the way they wanted it to. The only thing I would change at this facility is maybe the bottom drawer in this monitoring cart. I would have it a little bit more organized than what it is. Maybe get some, we tend to overstock here, so maybe take some stock away, make it a little bit more simpler. But anyway, that's the conclusion of my video. Thank you very much for watching.